Excelsior is the epitome of community health. It is a holistic way of looking at your health. Traditionally, you would go to the doctor to treat your mind, or you go to treat your body, and at Excelsior, it just makes sense to treat the body and the mind in the same place.
Today, we serve over 5,000 people in the community. We have an integrated network of providers. We have family medicine, we have counselors.
It's a place where you're coming to really build long-term relationships and a support system from every angle. Really creating a continuum of care, not just having a person go through one program and then saying, okay, hey, you need to go back out to the streets and figure it out on your own.
It's the place where the doctor is going to know your name the next time you show up. They're going to remember your kid's name. And today, I believe that relationships really matter. And so if you really care about your provider and the experience that you receive, Excelsior is like coming home to your family to get your health care.
The land at the Indian Trail campus is significant for so many reasons. First, people have used this land for centuries as a place of respite. It suggested that it was a place of commerce and a place of gathering, a place of real social connectedness.
When I first came here, Andrew Hill talked about the painting on the rock, and I was always interested to know more about it. And where it comes from is the Spokane tribe, and I know that the Spokane tribe has come up to Excelsior, look at the rock, and they talked about the history that come not only with the rock, but with the land, and how, it's really important to keep that here.
We have people who design beautiful buildings, but nothing to me is more beautiful than the natural environment, the evergreen trees, the arboretum that's on site. So you can see just about any species of tree or plant. It just reminds me of the 8 dimensions of wellness, which most of it originated for the original caretakers of this land, our tribal indigenous communities. And so the medicine wheel has been around a long time, long time. And so to have the 8 dimensions of wellness in this same site that many indigenous people gathered at, and to have a community that gathers in the same space is just kind of amazing.
The McKinley family homesteaded the property for many years, and this is when the local Spokane residents started to learn more about the importance of the site. In 1926, the Spokane Chronicle and even the front page of the New York Times talked about the pictographs found on the McKinley homestead. Of course, we know today that these are evidence of First Peoples' use of this land for centuries before that. The McKinleys really worked hard to keep the land in its natural state, and soon would transfer that land to the Sisters of the Good Shepherd. The Sisters of the Good Shepherd were actually founded in France in 1641. It wasn't until about the late 1800s that we really started to notice the need for a concerted effort around child welfare in the United States. And so we started sending kids west, and the orphan trains are an important part of our United States history. We literally moved children across the country. The last 2 stops on that route were Spokane and Seattle, Washington. And the Sisters of the Good Shepherd saw the need and built the Good Shepherd home in 1905, where Northtown Mall is in Spokane today.
2 of the Sisters of the Good Shepherd that were originally here at Excelsior in the beginning, they were just in town for something else, and so they stopped by. It felt so good when the Sisters of the Good Shepherd said, a lot has changed in here, but the spirit still is the same. That spirit of care, the spirit of love, the spirit of compassion, and taking care of the people in our community. And I think that is something that most employees here feel. And it's one that makes you stay here day after day, because the work can be hard, it can be tough. But at the end of the day, the investment is more than worth it.
I started October 28th, 1975 as an intern. I worked alongside the Good Shepherd sisters along with lay staff, and we were entrusted to take care of teenage girls and help them throughout their lives.
We have to help one another. Society has to help each other. And I thought about the programming that was helping here, the need for wraparound programming, the focus on integrated care, how we were touching education and we were touching these different facets of life. What's happening to you with behavior, mental health, counseling services, whatever you particularly needed, if the need could be met here, they were trying to help you here and help you with great care and concern.
So just as we've thought about how are we going to deliver behavioral health alongside family medicine and primary care, well, we have to line up multiple funding resources. And so in order to increase access for people who don't have the ability to pay or who have state insurance, we have to be able to align them and sort of mix that financial fabric together so that we can promote access for more people who are underserved.
It's not, I'm going to lead you in this. I am a partner with you in your health and your wellness. Nothing says I value you more than listening to a person, hearing what they have to say, and asking one simple question: how can I support you?
Drew and I had this moment, and I don't know, maybe a decade, 15 years ago, and we said to each other, you know, should we start something new or should we build upon what is? And we shook hands and said, let's build. And so there's a core of goodness about Excelsior, and there's a core of people who really want to make a difference. And so building upon that, but you have to change, you have to evolve. The models are going to be inadequate because science changes, communities change, needs changed. But if you maintain that core of hope, one, that we can do better, two, that the community needs care, they need thoughtful and listening people.
Excelsior is becoming a place where people can come and are welcome.
I love that they are flexible, they're caring, they have so many programs here that are much needed in our community, and they just will do anything for you.
I think they work from a level where they're truly coming to work and working with a sense of purpose. They want to be here. It's a sense of purpose here. And when you come to work and you want to be here, you can feel it, you can touch it. You know, it's a good place that they're doing what they want to do.
This village, it's an opportunity not just to provide access to all of these system resources, but it's also an opportunity to create a hub in a neighborhood that will care for people who experience these particular challenges, these particular barriers, and we see them across neighborhoods. And those are for elders in the community who are aging. Research is showing that people are aging and they're having to leave their neighborhoods. There's more loneliness. There's less opportunity to stay connected. Imagine with me, if you would, a neighborhood that has a hub or a center, a place where all of these different system resources have been aligned and providers from our community are there together, giving you access to the things you need right where you live.
Well, when I think about the community built around the 8 dimensions of wellness, I also think about the multiple generations that are in a community, but a space that's designed to have your seniors being able to naturally mentor young people in the community. Spaces that are created to gather where you can walk along a trail, finding the experience that that people probably had thousands of years ago in the same space, but to look at it in a fully developed state with so many different generations, so many different gathering spaces to shop, but also spaces to get your health care. And when you have a village built around wellness, you can't help but just be well. You have to live well, and you're able to stay well.
Anytime you build supports for people, you build that village, you're reducing costs on society and in terms of human suffering tremendously. They're not going to the hospital. They're not relying on these really expensive services. So in the long run, building this is going to save society tremendous amount of money. It's also going to save a tremendous amount of human suffering.
5 years from now, I envision people walking, riding bikes. I see people outside of the coffee shop sharing books. I see people walking on the interpretive trails. I see Excelsior.
When I think about the future of the village and I think about things that are going to matter most, elders are going to be able to have this opportunity for generativity and get all of the levels of care they need through their later stages of life and stay connected to the social fabric of that neighborhood. We're not going to watch a system come and stand in a place that we expect them to be today, but in the future, we won't need them to step into that space and remove that child from the neighborhood. In fact, the hub will preserve and protect that child who's lost their caregiver's right to belong in the neighborhood. And so I see single-family homes that are dedicated to the families of the neighborhood who said, we will foster this kid, we will keep them here, we'll keep their belonging intact, and we'll provide it here within the neighborhood. The transitional housing opportunity in the hub is that there are places for young adults either leaving their family's home or returning from a university or study abroad, whatever it might be. There's an opportunity for transitional housing for these young adults to get on their feet, practice their independent, community-based living skills, look for their first jobs, and we're really developmentally being responsive by giving them their own space, letting them seek their own novelty, and we're giving the families an opportunity to watch their children leave that space, but have confidence that they're still in a spot that is secure. And so I think young adults are going to experience something transformative and supportive. And then I think elders are going to use that same transitional housing resource for stages of life where they have to downsize or they have to figure out something different or they've lost a spouse, and the financial wellness of that person is shifting or changing. Let's let that transitional housing step in and say, hey, we got you. And while you're here, let's talk about mentorship opportunities with these young adults.
We want it to be a place that the neighborhood goes. So much of Indian Trail has to go down to get some of their needs met in the form of healthcare or breakfast spot, yoga, all those things they have to leave. Well, what if it was there? We think we can keep people there. And also, so much of our work has changed. There's so many remote workers who want to live, but they also want a vibrant place to walk their dog. They want to have stuff in a walkable neighborhood, and this is a chance to do that.
People on Indian Trail and clear out as we've grown don't understand the work we've done here. Taking care of kids that have been traumatized. Having people, seniors like myself, childcare, community center, places where people can come and meet and either learn, enjoy, and just be a part of Excelsior is pretty exciting.
when I started at Excelsior, it was actually after the meeting with Andrew Hill. I went out to the baseball field. There's a bench out there, and that's a space that I go to just to kind of refresh. And I'm excited to sit at that bench again and look at what's been developed. 5 years from now will be almost 10 years for me at Excelsior. So to really sit down and reflect and just take it all in, and just see how vibrant and busy, seeing the community come to the campus and really appreciate it, to see, more youth being involved in programs and feeling safe and the smiles on their faces, and being able to walk through the halls of Excelsior and seeing the staff being satisfied, and eager to really, continue the work that we have been doing, and keeping the tradition going.
It takes a village to take care of children, and it takes a village to take care of yourself. No one can do it on their own, and that's why I love the Wellness Village, because it's centered around people helping people.
Taking that saying of it takes a village and creating a village and really staying true to that. So I'm really excited to see it all come to life. It'll bring a new type of motivation to a lot of people, especially when it comes to mental health.
I want to live in it. I want to be a part of it. I think I would love to be a part of that.
You always hear that it takes a village, but you never hear how. And so I think this is our chance to say, hey, we got 100 years of serving people. We've learned a lot. We're surrounded by community members who are ready to share what their needs are. And we have this space. We've been gifted an opportunity to build it. And so let's figure out how. Let's not just say it takes a village. Let's build it.